I wish to return to a matter which was previously raised with you, Minister, and that's nurses. Obviously, we owe everybody in the front line a huge debt of gratitude, including nurses. And we have stood, all of us, and applauded them. But nurses can't live on applause alone. None of us can, although applause for politicians is rare and maybe deservedly so. Will you set a deadline by which the pay agreements which we're into, that you will use your legal powers to force them through if they are not already implemented by a certain point? That's the first question I have. We've talked a lot about mental health today in the Chamber. Will you have a representative of psychiatrists, who are the people responsible for the delivery of psychiatric and mental health services according to the system in Ireland? Will you have somebody to represent psychiatrists appointed to NPHET so that they can participate in the decision making that NPHET undertakes? You talked about a new way of doing medicine, Minister. The deal that was done with the private hospitals, the effective takeover of the private hospitals, is not something that I would dare to criticise, because nobody at the time knew what we were facing. Now, thankfully, our hospitals have not been as overwhelmed as we feared. And those private hospitals have not been working to capacity or anything like it. I believe you gave figures for the Bon Secours in Cork. I'd ask you to confirm that there are 142 beds used in the bonds in Cork at the moment of the 300 bed capacity, and that's the hospital which is most used. All of the others are working at even less capacity. Is it the case that the doctors who worked in those hospitals can no longer carry out any work for private patients, even on a pro bono basis? Is it the case that, for example, a colposcopy, which is a testing procedure for cervical cancer, that they are no longer able to have that carried out in respect of a patient, an ongoing patient, if they haven't signed the new contract? And if so, that would be, I think, we would all agree, very worrying. And lastly, I understand NPHET are looking at a proposal to carry out non-elective work in those private hospitals now, because there is capacity in them, but that is going to cost 115, there's an anticipated budget of 115 million euros per month. Now, if that is the case, the budget for all of that work last year, the NPF was 75 million for the entire year, as opposed to 115 million euros for a month. Now, there may be a lot of reasons for that increase, but it looks to me like it could be a very bad deal for the Irish Exchequer at a time when we all know our Exchequer figures are plummeting. I know there's a lot of questions there, but I'd appreciate answers to at least some of them. Thank you.
I do my very best. Thank you. Firstly, I want to congratulate you on your election as Chair of the COVID Committee, and look forward to any cooperation my department can provide you with in discharging your duties. It's going to be an important role. In relation to the enhanced nurse contract, look, I gave figures earlier. When I was last in this House, I think there were just over when I was last asked about this in this House last month, I think there were just over 3,000 staff nurses who'd been appointed to the new scale. That was up from 700 in February. I believe the number's around 4,500 now. I'm expecting to see a very significant increase on that further in the next week or so when I get updated figures. And at that stage, I will make a decision as to whether I need to issue a direction to the HSE. Not detecting an unwillingness in the HSE to do this at all. So I'll give you an answer on that within a week. In relation to the private hospital issue, and I think you were right, and you acknowledged the reasons and why it's done. Obviously, there is now a review period built in from the end of this month to the end of June, where I'll have to decide, in consultation with government colleagues, and particularly the Minister for Public Expenditure and Reform, whether it makes sense to renew the contract, whether it's needed, and we'll be considering all of these issues. So we will use that review period to the fullest in terms of, obviously, value for money for the taxpayer, but obviously the needs of the Irish Public Health Service. Of course, though, if we're going to be paying for the use of the private hospitals, I think we'd all agree we want that used for public patients. I don't have that figure in terms of number of vacant beds. I just have the percentages I gave out earlier, which I'm happy to send to you in writing, and I'll also correspond with you specifically in the interest about psychiatry, which you have raised with me. We do have a psychiatrist, Dr. Hillary, on the Medical Leaders Forum, but the issue of having a psychiatrist on NPHET is something I'll discuss with the Chief Medical Officer and revert to you.